I don't like this filter. Oh my God, that looks crazy. Hi guys. Oh, I think we're ready.
So what does that look like? Oh, I got
Hi
to.
guys.
Hi,
How
how
are
you doing?
you? I'm
I'm
great.
good. Thanks.
Thanks for coming on.
Yeah, thanks for having me. I'm looking forward to it.
You good? Is this all new for you?
It is actually, yeah, the Instagram part, but
Yeah, I'm
done
sure.
interviews and other things before.
So I'm excited. How do you say your last name? I didn't want to say it wrong.
Malanga.
Malenga. Okay. Dr. Malenga. Do they call you Dr. M or Dr. G for short?
Um, no, I mean I mean, Doc is what we'll just say Doc, but
All right, so I'll call you
yeah,
Doc.
yeah, you can call me Doc if you want.
So I'm excited because I do have clients that have gotten PRP done.
Hmm.
But I think it's important to educate people on what it is because I'm an advocate for it. I feel like if someone's going to rehab or they're getting recovery work done and it's just not working,
Yeah.
and they're not getting the results that they want, I always like maybe you should consider PRP or stem cells. What's the new term? Regenerative cellular therapy now?
Cellular, yeah, cellular regenerative treatments. I mean, yeah, because the word stem cells is very specific and should be used in specific, and the FDA freaks out
Okay.
when people use that term, especially if you're advertising or you're involved in a medical treatment area. They're looking to hunt people down.
Oh, okay.
Yeah, so you got to be really careful.
So what I've experienced in the past, either some of my clients have gotten it done and they weren't really educated on the stem cells. So
Yeah.
I've had clients come in and they're like, or they've gotten it done and they're like, I need to get a session in with you. Wherever they got injected, they're like, it's burning, like it's inflamed. And I'm like,
Yeah.
that's normal. I'm not
Yeah.
touching you.
Yeah.
But it never gets explained. Well, not that it nevers, but what I experience, like sometimes it doesn't get explained and they freak out.
Yeah. 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 Yeah.
So can you just
Yeah.
explain to people what PRP is first, and then we'll go into stem cells or regenerative cellular therapy?
Sure. So PRP stands for platelet-rich plasma. So platelets are these small little cells that circulate in our bloodstream that help us to heal. Like every time you have a cut, every time you have a fracture, they're very important. On platelets are these various growth factors that get released when you have a tissue injury. And those growth factors are extremely helpful to help the tissue to heal, to reduce pain and inflammation over time, and to get things back to baseline. There are certain chronic conditions where, for whatever reason, your body's just not signaling enough and getting enough of the healing response that you need to add something to stimulate healing because, and this is something that's lost in most of mainstream medicine, the human body's intrinsic capabilities of healing is incredible. And so we need to nurture that and find different things that help to facilitate that. And that can be through a massage, a exercise program, an acupuncture treatment, anything that can help your own internal body start to signal healing. Unfortunately, most medical treatments work against that. So we prescribe anti-inflammatory medications. People are given cortisone injections. People undergo surgeries, and they're not really working in conjunction with our own natural capabilities of healing. So where does platelet-rich plasma come in? Well, if you can get enough blood out and concentrate that blood, so you concentrate the platelets, so that's why it's platelet rich in the plasma, which is the circulating blood volume, and then carefully inject it into an area that's not healing, then you can basically recharge your body to heal itself. with all those nice growth factors in that area to facilitate healing. And, you know, platelet-rich plasma has been around for 20, 30 years. It was involved in dentistry to help with healing dental implants. It was involved in cardiothoracic surgery to help people when they had their sternotomy wounds, and really helpful with that. It's been involved in plastic surgery, and in hair loss. It's been involved in wound healing. And in orthopedics, it's been around, you know, probably about 15 years to help with chronic tendon problems like a tennis elbow problem. And then in the recent 10 years, it's been really helpful for helping people with knee arthritis and cartilage problems and things like that.
So what is it when you get it done that causes that inflammation, that inflammatory response?
Yeah. So many people, right after they get their PRP for 24, 48 hours, you know, 2 or 3 days, like they get this response like, wow, it's unbelievable. That's the time frame where you get the release of all these growth factors. So, you know, I call it like primordial soup. So it's almost a good thing that you know something's going on. Sometimes the variation, you know, PRP is a very generic term. So it's like saying car, right? Your car could be a Bug or it could be a Maserati. So sometimes if it's not a very high quality PRP product, it's contaminated with red cells or certain white cells that can make that inflammation feel worse. And so sometimes it's that causes a worse type of, you know, soreness. But again, that usually resolves within 3 or 4 days. Then after a week, after you get your PRP, you may not feel anything. You might say, oh, I don't feel any different, because it does take like 4 to 6 weeks for those growth factors to do its thing, for your body to be signaled, for those tendons or the cartilage cells, for the inflammatory things to get changed. And so realistically, you know, if you have a knee injection for some early arthritis, it's about 3 or 4 weeks before you feel better. For a tendon problem, it can be 4 to 6 weeks before it feels better. And, you know, that's just the way nature is. Nature, you know, when you plant a seed to grow a tomato plant, you don't put tomatoes like the day after. You know, the tomatoes come several weeks to months later, but things are happening while you're doing that.
So how often should they get PRP? Like, do they get it once, or is it a series of 3?
Yeah. So the series of 3 is some kind of crazy magical number, either in the mystical world, baseball world, where, you know, you have 3 strikes and you're out. Or maybe if you're a Christianity, you say Father, Son, and Holy Ghost. But yeah. But it's not really based on anything very scientific. Some of it's based on the fact that when they first came out with those lubricating injections, like the Synvis type injections, those were always done in quote unquote a series of 3. And way back when people got epidural injections, they were also done in a quote unquote series of 3, all based on really flawed medicine and science. And so the PRP world, the pain management world, and even, you know, some orthopedic people have kind of slid into this flawed thinking that PRP should be given in the series. Yeah, but that's totally untrue. So for us at New Jersey Regenerative Institute, my practice, we basically, it's a one shot and you're done.
Got it.
Yeah. So, but the PRP that you give needs to be a very high quality. So if you deliver a very low quality PRP that delivers only a small amount of platelets, that may be the reason why people recommend or need those 3 shots, because they don't deliver enough platelets with the one single shot.
Got it. And so how do you ensure you're getting like you're getting the most platelets when you're doing it? Like a quality?
Yeah. Well, as a patient, you're reliant on the clinician, the doctor, whoever is giving you the injection. I would say that's pretty unreliable most of the time, unless you've talked through the physician and say, why do you use the PRP system that you use? There are about 30 manufacturers of PRP products, and the consistency of those products is a wide range. And so for us, again, we actually test out we run it through an analyzer before we inject. So we know exactly how many platelets, how many red cells, how many white cells. Now, many clinicians would say, yeah, I don't have that equipment. It costs too much. So the manufacturers will say, well, our PRP product delivers this amount of platelets and white cells and red cells. If they're a reputable company, that's fine. There's been some independent research to talk about certain products and what they deliver. And so your clinician should be aware of those research studies that say this product consistently delivers this amount of a platelet content and other things. And so if you use it, every once in a while, though, that clinician should test that out to see how well they're doing themselves. So, but unfortunately, you know, like I said, there's 30 products. I would say only about 5 have a quality PRP for orthopedic type conditions.
Got it. Okay. So what do you see the most in your clinic? Like what's tendonitis, tendinopathy, hips, knees, all of it? How about rotator cuff too? Is that a big one or no?
Very big, very big. So we see all the big stuff that you see in orthopedic practices. Okay. So big knee pain, knee arthritis, big tendon problems. So tennis elbow, rotator cuff, wear and tear, Achilles, patella tendon. So we basically, and we've collected data on it for about a decade. We're one of the very few practices that collect data. In fact, I've started a database company called Data Biologics, where everyone can collect their data if they want. And we're hoping to collect enough data from multiple clinics to really tease out what works and what doesn't work.
Got it.
For the clinician to understand that and for patients to better understand what works for what specific diagnosis. Because you can't use the same thing for everything. Mm-hmm. It doesn't make sense, right? It doesn't make sense that your PRP will help with wrinkles as well as arthritis, as well as with a rotator cuff tear.
Yeah.
That's, yeah.
So what you're trying to decipher which one would be the best that you can use?
Yeah.
Okay.
Yeah. So, yeah. So it takes doing a careful history, physical examination. We do ultrasound examinations for tendon problems and joint problems, because you can then refine your diagnosis. Sometimes an MRI can help. And then you want to use the product that has the best track record for that diagnosis based on, you know, published medical literature and other things.
Okay, I like that. And
yeah.
So so now we know what PRP is, and I just found out this year that you could use it for the hair, because I work on one of my clients is a plastic surgeon, and so he was telling me they do the PRP for the hair thinning, and they've been doing a lot of it since COVID, because a lot of women have been losing their hair. So the regenerative cellular therapy, what's the difference between that and stem cells?
Okay.
And how can you assure that you're getting, because I have, I'm going to be 42 next week, so I have a 16-year-old. When I had her, they came to me right after I gave birth and asked me if I wanted, but I didn't know anything about it. So I was like, how am I think I had to pay like $500 or something for them to hold it at the time. But I was weirded out, because I was like, how am I supposed to know that I'm getting my child's stem cells? Like, they're holding it for 20-something years. God forbid I need to use it. How do I know it's hers?
Well, so those are banked umbilical cord cells.
Yes.
That were meant for either that person or a blood family member, in case they developed any type of leukemias or blood cancers.
Yes.
You can tap into that, and that can be invaluable. It's really not meant for anything orthopedic. So now that whole umbilical cord, amniotic fluid, all that world now has been really taken advantage of. And there's been a lot of, like, I would say, false advertising of those products to say that they can cure, or help with arthritis, help with tendinopathy. And there's basically almost no literature on that. The FDA has really clamped down hard on that. The actual number, they say, well, your doctor can have it in a vial and just pull it out with a needle and inject you. when you look at what's actually in that vial, there are no real viable cells. It's, again, a lot of false advertising, with people getting charged lots of money.
So I did the right thing because I was like, I'm not doing this. I don't know if this is gonna like 20 years from now if it's my kids.
Yeah. Yeah. So, I mean, I think the future, there might be some benefit in taking, and it needs to be studied, but it needs to be carefully studied. And it's going to take a lot of time and money to do that. So what these companies have done is they've pooled women's umbilical cord cells and other products, their Wharton's jelly, their amniotic fluid, and then they kind of grow that in a lab. And there may be some benefits in the future, but that needs to be really carefully studied. The other area of cellular treatment is taking your own quote unquote stem cells. Now, the word stem cell is very specific, and you need to kind of do all this laboratory testing to actually call something a stem cell. But we know those types of cells exist in people's bone marrow and in people's adipose tissue. So if you're not really sure it's stem cells that you're delivering to somebody, the more proper term is to call it a cellular procedure. And you can call it regenerative, but the fact of the matter is that the regeneration, like everything becoming new, is probably not as important as the improvement in how somebody body feels and functions, so their pain and functional capabilities. So even the term regenerative, you have to be very careful because it pulls on people's emotions, and it can border sometimes on false advertising. But there's a lot of research on taking bone marrow, especially from the back of your pelvis, and processing through devices, or taking adipose tissue and again cleaning it and breaking it into smaller pieces. That's called microfragmented adipose tissue. That can have incredible benefits for rotator cuff tears, meniscal tears, knee arthritis, a lot of these different things. The more difficult things to treat, where PRP isn't going to work. Yeah.
So do you do PRP and cellular therapy in combination? Can you do it? Because I worked for a facility that tried to do stem cells when it became the hot thing. So their combination was like PRP first, you inflame the area, and then you inject the stem cells so they know where to go, because their job is to repair everything.
Right.
Is that similar to what you do? Do you do it just always separately?
All right. So a couple of things on that. So there are people who will use a series of type of injections and will maybe do a PRP first, and then let's say a bone marrow, and then maybe another PRP later on. I think that's interesting. There's on a basic science, on a laboratory setting, the quote unquote stem cells really respond to the various growth factors that are released, and there's a positive response, either bone marrow or adipose. The FDA would especially say that you couldn't mix those two together and inject it together, because the FDA would say that you are creating a quote unquote drug, which sounds weird, but there are people who try to work around that and say, all right, you have knee arthritis, I'm going to give you your adipose injection, and then with another needle, I'm going to give you PRP, because again, in a laboratory setting, adipose cells really respond to PRP. Unfortunately, or the reality is that when you look at the research to look at whether there's base improvements or outcomes that are better, it hasn't panned out that way. So people do as well without the PRP as they do with just adipose, or they do with just bone marrow. And so, combining them sounds interesting, but it's another procedure. It's another cost to the patient. And so until we refine which patients and which condition would benefit from the combo, and in our practice and in our database, we basically will do one type of procedure based on the pathology that's there. Mm-hmm. Yeah.
So when you're doing like something like a rotator cuff, what actually is it repairing? Is it repairing the cartilage? Is it repairing the tendon or the muscles, or what's happening?
So the rotator cuff are tendons that insert onto the ball of your shoulder, 4 tendons, but it's usually 2, the supraspinatus and infraspinatus, that are really commonly involved. The supraspinatus, which is the one on top, is involved, probably 70 to 90% of the time. The interesting thing is that over the age of 40, if you took MRIs of people, 30 or 40%, and they have no problems, they're exercising, they're lifting, they're doing CrossFit, 30 to 40% of them will have a rotator cuff tear, especially a partial tear. So, and it's only if you have pain that you go see an orthopedic surgeon or a family doctor, you get your MRI, and they say, oh, you have the partial tear. But the literature would say that surgery is no better than a really good therapy program if you go to a good therapist, physical therapist. Now, if you have a complete tear, actually the 5-year follow-up data on a complete tear, surgery versus non-surgery, shows no differences in outcomes. But there are people who are left with pain even after they do good physical therapy. Based on the literature and based on our clinical experience, if you have a partial tear or a wear and tear of a tendon, PRP can work pretty darn well. So you put PRP directly under ultrasound guidance. You guide that needle right into the area of wear and tear. The needle itself causes a stimulation of healing. You put some into the tendon and some into the bursa, because the bursa, which overlies the tendon, often gets irritated and inflamed. If it's a complete tear, PRP is sort of a waste, quite frankly. And so our experience is that taking something like adipose tissue, which acts like a substrate to fill in the tear and also releases the growth factors, can be really helpful, probably in 70% of patients, 70 to 80% of patients. It really is. It's been really gratifying. We just finished a study in patients who are wheelchair dependent. They're paraplegics who have rotator cuff wear and tear and tears. So a really difficult group to treat because they're using their arms like we use our legs every day. And again, we had a 70 to 80% success rate in that group, and it was so gratifying to help that group out. And we have the same kind of experience with people who are not wheelchair dependent folks. Yeah,
that's interesting. I didn't know that, but the success rate 70% is really big.
Yeah. I mean, let me tell you, for us, number one, these things are not covered by insurance, so they cost money. And so if we're going to offer something, for us, it better work, and it better work really well, because people are expending cash for what we're doing. So, yeah.
So what would you say because I know there's some other places that say they do PRP, and I've had clients like, well, I got it covered underneath my insurance. And I'm like, I don't know about that. And I'm like, I don't know if you were getting what you thought you were getting.
We've tried different things, and it's been like banging your head against the wall, a lot of frustration. We hope with the collection of enough data and information that we can get a proper code. There is something called a T code for PRP, which is sort of a testing code. That's not a real code. The insurance company will say they'll pay for it, but the average PRP injection is about $750 to $1,000. The insurance company will pay $50, so they won't even pay for the cost of the kit that you used to provide the treatment, let alone your time and energy and all that. So meanwhile, the cost savings are enormous when you compare it to multiple physical therapy visits or surgery or other things. Yeah. So, yeah.
If you look at throughout the time span of how much money you spend on your copay.
Yeah. So, yeah, exactly. So, everyone asks, why does an insurance company pay for these things? If it's so good. You have to study what insurance means or is. Insurance companies are not interested necessarily in providing you with the best treatments. They are interested in taking in some premiums, paying out some stuff, and then making sure there's some money left over. So,
correct. Yeah. Listen, you don't have to sell. I know. Yeah. I try to tell my clients all the time.
Yeah. And more and more people are starting to know that fact. So, I mean, at some point, we have to take control of our own health and our own, and spend money wisely. Try to get the least costly insurance plan that covers the catastrophic things, and then use a health savings account or other things to spend the money wisely after that.
Yeah, health is what I totally agree. I totally agree. And I try to tell people that all the time. Like they don't necessarily have your best interest at heart. It's a business at the end of the day. So have you seen anything with back pain? Do you guys use it for back pain or no?
Yeah. So, I mean, I think the old notion of pain management for back pain, where you get shots of cortisone injection, is really poor, meager, not well supported. But that's what people get, and that's what people are offered. Probably the main reason why is because it's covered by insurance.
And they pay,
so people get these repeated. So, but it's not very robust, and in fact, it's not very thoughtful when you look at the basic science of back pain and all these things. So now many of our epidurals we do with PRP, our facet joint injections, sacroiliac joint injections, and ligament injections we'll do with PRP, because PRP is meant to modulate pain and inflammation and facilitate healing. Cortisone is like napalm and destroys everything. You feel good for a few weeks, but it doesn't. It doesn't facilitate your own capabilities of healing. In fact, it gets in the way of that.
Yeah, I try to tell my clients that's why I'm like all about stem cells and PRP, because it's your body healing itself.
Correct.
And like that's what the body does. Why just allow it to do that? Sometimes you need to help it, but don't add any foreign things that are gonna
interfere with it.
Interfere or not facilitate what you need it to facilitate. So so you do more PRP instead of like epidural injections rather, or do you do a combination of both?
Well, we do the same way you would do the epidural, but instead of injecting cortisone, we inject PRP around the nerve, or in the epidural space. So
I might have my dad come to you guys, because he's gotten epidural shots before. He's gotten like, I think he did this series, the 3. But the first 2 he was fine, and then, well, the first one he was good. The second one not so much, and then he decided not to go back for the third one. And he has arthritis in his spine and a whole bunch of stuff going on.
Well, it doesn't make sense to keep doing it. Number one, series of 3. Again, we talked about that. That makes no sense. And the overall concept of how that's going to really help is really flawed. And in fact, if you look at the literature over time, it really doesn't support it very much. So, but insurance keeps paying for it, which is it's a head scratcher, right? Because if the literature shows it really doesn't work, why do they keep paying for it? But once something's in, you're in. You just keep getting it.
Yeah.
But it's not in the best interest of patients.
Yeah, I agree. I try to tell people, like, they'll say they got an epidural and then maybe a year or 2 later they needed to get rotator cuff surgery because everything was just damaged inside. I'm like, it's not what you did. It probably was from the injections you did like 2 years ago that just wreaked havoc in your shoulder, which you could have probably prevented from doing rehab or some type of like maintenance on the arm. Do you guys do anything? Do you do regenerative stuff for the face too with PRP and here, or you just strictly do orthopedic?
We pretty much stick to the orthopedic world. We have a colleague who comes to our office and offers those treatments, facial, wrinkles, and also hair restoration treatments. So, I mean, for us, really being experts in orthopedics is enough. I kind of worry about offices and practices where you go there and they can take care of like your orthopedic problems, your neurologic problems, your plastic. I think, I'm not sure you can maintain a real high level of expertise doing all of that.
I agree.
Yeah.
So who would be a good candidate for PRP? Would you recommend they do rehab first, and then if it's not getting better, then they need to look at another option? Um, what
Yeah.
would you consider a good candidate to like come
Yeah.
into your office?
So many people come to the office or maybe get referred because either they know we do PRP or heard we do PRP. And many of them haven't even done the basics of things like good rehab, nutrition, diet, supplements. And so for us, the algorithm is do the least invasive, right, least costly thing. Um, but also it has to work. So just because it doesn't cost much and is not invasive, if it's not going to work, then why
Yeah.
bother, right? So we need to think about number one, is it safe and is it going to work? And then go from least invasive. Um, and so for us, I have a whole sheet where I go over all the different options. And so, but if you've tried everything, you said, well, I've watched my diet, cut down sugar, cut down carbs, tried to lose a little weight, taking curcumin, taking glucosamine chondroitin, whatever it might be, went to a really excellent therapist, and this thing just not coming around. Then those are the candidates for PRP. They have, on their history, they say, oh, I got this problem. I do this, certain things. You examine them and you say, yeah, it looks like that. You might do an ultrasound and you might demonstrate the findings. And then you say, yeah, I think you'd be a good candidate for PRP or a cellular procedure, depending on what you find.
Depending on how severe it is.
Correct.
Okay.
Correct.
Um, Tell people where they can find you. Listen, this was a great conversation. You explained it very well because I love people who just break it down where other people can understand. This was
Yeah,
really
thanks.
important for me because I do have therapists who follow me, but I do have clients. And again, a lot of the times I have clients who have gotten PRP, but it wasn't explained. Like they just got it done and nobody
Yeah.
kind of explained what was going to happen. Because if you're calling me 24 hours that you have inflammation, it's inflamed and you want me to cup you or something, I'm like, no, I'm not touching you.
Yeah.
You got to let the body do what it does. I'm sorry. I'll see you in 2 weeks or so.
Yeah.
But
Well, I think patients need to take control of their own health and their own lives. They need to challenge their doctors a little bit, not in a adversarial way, but they need to say, okay, help me through this, think this through. If your doctor doesn't have the time to sit down and explain some things, explain, why they would do this versus that, why, what their outcomes are, do they collect data? Do they have their own outcomes? Why are they using the product they use? Why would they do it in a series of 3 when this guy Malanga says that doesn't make any sense? All this. They need to do their own reading. And that's even if they go to somebody that says, well, you need to have your rotator cuff repaired or you need to have your meniscus shaved down. Man, you got to question all of those types of scenarios. And then you have to, it has to resonate with who you are as a person. And then for me, I think, and for most people, you say, well, what is the most natural thing I can do to help my body to heal? And it has to make good sense. So, my office is in Cedar Knolls, New Jersey. I have 2 great partners. We have a fellowship as well. It's njregenerativeInstitute.com is the website. Yeah. We've really worked hard and dedicated ourselves to really using, the best techniques, the best products, the best understanding. We always do some sort of either training or rehab afterwards because that component is really important for as the tissue improves to start layering down the forces as all your good trainers will be aware of. And those outcomes are much better when you add the therapy, exercise, components as well.
That's old too, where people were not moving after they had some type of
Yeah.
invasive.
There's so many.
Yeah.
The benefits can get undone in so many different ways, ranging from not informing the patients of what to do and not to do, the rehab part, and the right products done the right way. not using ultrasound to guide your procedures. There's so many different nuances, and that's why we still sit in this massive debate of certain people saying PRP is a waste and doesn't work, and this other group that says PRP works, and maybe this other group that says PRP solves all of our problems, or all these stem cells will cure everything, which is not accurate. And so we really need to get to that sweet spot of, for what person, what product, what technique will work.
I love that you're transparent about that, because there's no end all be all. You have to find what works for everyone.
Correct.
What works for you is not going to work for me, but I love that you're transparent, and it's just not like this is going to solve all of your problems.
Well, you know what that's called? It's the buzzword in medicine, in mainstream medicine, and that's called personalized medicine, meaning you match up your treatment to the person that you're treating. That takes time. You have to first get a history, understand what the person is, understand the pathology, do a good exam, do the ultrasound or imaging, and put all those things together. And many of your clients, your followers will know most of these office visits are like 10 minutes, right? So how can you in 10 minutes really develop and perform a personalized approach to the patient? You can't.
You can't.
Yeah.
Yeah.
And
and in my opinion, that's like when the insurance comes in, because it becomes this assembly line of, you don't have enough time. Some of them don't have enough time, judging on how the facility or the practice is ran.
Yeah, but patients as consumers should demand that appropriate time is spent. Otherwise, right.
I absolutely agree. It means that makes a world of difference. And people actually, they appreciate it. Like they feel like, okay, now I have a better understanding of what's happening, and they can make a decision based on all the information that you're giving them, and feel good about that decision going forward, instead of like, he told me this, okay, like, and so I don't really know what's happening, but I'm just gonna do it because he's a doctor and he says this is what I need. Don't
do it that way.
And I try to encourage people to do the same, like ask questions. It's not just because they have a white coat on doesn't mean
Don't give up your power. Don't transfer your power. Appreciate what somebody's trying to do for you. Ask the good questions, but don't just do something because someone just said that's what you need to do.
And I love that. And that's why I wanted to have you on, because I want people to know and understand better. Because I feel like I said in the past, people were getting it done, but not understanding what was happening to their body, why they needed to get it done. And I feel like people hear the word being thrown around, but don't know what the benefits are. And I love that, I'm a big advocate of holistic healing, letting the body heal itself, doing whatever you can to heal inside and out. And this is something that, I'm a big fan of. I have a bunch of clients who get it done. And so I'm like, I wanted to interview someone to explain it better than I could. And, just educate people. Like, this is an option. You don't have to go necessarily underneath the knife. If you're not happy if you're still in pain and you're going to physical therapy, nothing's happened, and you're going to a recovery specialist, nothing's happening. This is another alternative for you.
Yeah.
It may be costly, but think about the amount of money you spend on your co-pays throughout the year.
Yeah. We're going to do some studies looking at comparative cost analysis, but at the end of the day, this ends up being the most cost-effective, efficient, best interest of the patient. So I really appreciate, this platform to get the word out, because there's so much misinformation on both sides. The one side that says, it doesn't work at all, it's a waste of your money, and the other side which says, it cures everything. And, so I think, unfortunately, the consumer, the patient, needs to try to dig through all of that. And I'm hopeful that I can be at least a voice of balance and reason that can be helpful to others.
Well, you did a great job. I really appreciate you taking time out. I don't know if you're at work, but I appreciate you
Yeah, no,
taking
thank
time
you.
out. I would love to do this again if you ever want, you know, to put something on the platform or just have another conversation about something else, you know, going on. I would love to do it. I'm all about trying to educate people, letting them know that they are in charge of their own bodies and health.
Yeah,
They have the ability to heal themselves and fix themselves. So this was
yeah.
great. I appreciate you.
Yeah, you're welcome. Yeah, yeah, I'd love to do it again. I don't go on Instagram that much, so it would have to do just maybe send me a message by my normal email or something,
I will.
or yeah. There was a question about hip osteoarthritis somebody sent in. It can be helpful if the hip arthritis is not too severe. If someone hasn't lost a lot of hip joint motion, it can be very helpful. Um, Unfortunately, with hip arthritis, people often don't have a whole lot of pain until it gets really bad as far as the arthritis. But if you have pain and inflammation and the joint isn't too arthritic and the motion is still okay, there are studies to support PRP for hip arthritis. Yes.
Okay.
All right.
I have a gymnast who got PRP done to her L5S1, I think it was. She was getting excruciating pain, like even
Okay.
to do her back bends, and she
Yeah.
swears by it. She said
Sure.
it saved her career.
Yeah. Yeah. It's very gratifying when done properly, right, with the right product, with the right techniques. It doesn't solve all problems, but wow, it can be really helpful for people.
Yeah, yeah. So I'm a big advocate. Anything else you want to say before we go?
No, thanks for having me on.
Oh, it was my pleasure. Thank you so much.
Okay.
Again, I'll let you know when you, if you have time, if we can do it
Okay.
again. But I would
Yeah.
love to do it. All right.
I love talking about it. So thanks again.
Thank you so much.
Okay. Bye-bye.
Bye bye.